Good morning. Welcome to the info seminar for the Master of Medical Laboratory Science. So the program code is 55007. So first of all, I would like to introduce this program. So this is the only full-time master program in medical laboratory science offered by the UCG funded university. So that one, in terms of the names of the program is quite similar to another one offered by our department. That one is we call it MSc in uh, medical laboratory science, and this one is a master of medical laboratory science. So the difference is this program is dedicated for the applicants. So the graduates are eligible to apply for the registrations with the MLT board. So after you graduate with this degree, you will be eligible to apply for MLT Part 2. So this program actually will provide both the fundamentals and the advanced training on all the discipline in the medical laboratory science. So first of all, the laboratory medical laboratory science, which is not a biomedical science and scientific degree, which actually is one of the healthcare professions in Hong Kong. So you need a license to practice in the clinical laboratory. So the medical laboratory scientists, they will perform the clinical laboratory analysis as cellular, biochemical, and molecular level. So we will routinely analyze on the patient's specimen, including the body fluid, urine, stool, tissue. So the purpose, the duty of the medical laboratory science, or we call this a medical laboratory technologist, in short, we call it MLT. So the MLT, the duty is to detect and diagnose human disease. So, and also based on the results, sometimes we need to monitor the treatment of the patients. We see whether the therapy is effective or not. And then the fourth duty is to promote health and disease risk assessment, like the body checking. So in a clinical lab. And also finally, we need to investigate the underlying mechanism of the disease. So this is our curriculum. So our curriculum is actually spanning 2 years. So composed of 91 credits in 6 semesters, which include the summer semester. So the first year is the first semester, second semester, and then also we could include in the summer. So within this 81 credits, you will need to learn about some core subjects, which is composed of 39 credits. And most importantly, you will learn about the specialism subjects. So we will talk about the specialism subject later on. So, and then you are allowed to choose one elective subject. And most importantly, you are asked to go for the clinical attachment because after this program, you will become a licensed MLT. So you need the clinical experience. So that's for we will take the periods of the summer semester, and then you will go to either the HA hospital and also the private hospital for the clinical attachment for 12 weeks. So it composed of 10 credit. In addition, you will have one more credit on the academic integrity and ethic requirement. So now we talk about the specialism subjects. So you may know in the field of medical laboratory science, we have four major specialism. The first one is cellular pathologies. The second one is medical microbiologies. The third one is clinical chemistry. And finally, the hematologies. So we talk it one by one. So first of all, in the specialties of cellular pathology, or actually another terms in the public hospital, we call it anatomical pathologies. So basically, in this laboratory, the MLT responsible for microscopic examinations of the patient tissue sample. So when we have when a patient suspected to have cancer, they will go for like the checking, and then sometimes the doctor will take some of the tissue sample for the laboratory to investigate. So the specimen, the tissue, will cut into a very thin sections or smear. And then in the laboratory, the MLT will be responsible for staining, for treatment of this sample, and then to look at any abnormalities. So the sample including, for example, the liver tissue, the colon tissue, and also the pap smear. So this is the routine workflow in this laboratory. So like I said, the doctor will collect the tissue sample. So they will send to the laboratory. So to prevent actually the tissue to degrade or actually affect the morphology. So in the laboratory, we will fix um, the tissue. After that, we will embedding in the some of the paraffin wax. So you got a block right here. With the block support, then you can cut it into a very thin section by using a instrument. We call it a microtome. So the thickness is only composed of the 4 micrometer. So after that, you will mount it on the gas line, and then after you go for different kind of the staining. It depends on what kind of cancer you're going to look at. So, in the training, I mean, within these 2 years, you will learn how to differentiate a normal and also the abnormal tissue sections. So, on the left-hand side, which is a normal liver tissue, while on the right-hand side, which is a cancer one. So, you will learn how to do it. So, you will have the practical examinations. You will given a series of this kind of the stainless smear, such that I mean, we will assess your ability to differentiate the normal and abnormal. So the second specialism is clinical chemistry. So that part, I think you should you have a better knowledge on that. Basically, when you go for just a private clinical laboratory or kit just a private laboratory, so you will go for the blood test to test for the glucose and then a test for the urine. That is the exactly the specialism dealing with that. So you will investigate the body fluid to determine whether the patient's having the metabolic disorder. So you will measure the electrolytes, for example, calcium, about potassium and sodium, enzyme, okay, liver enzyme, hormones. So that actually is you're going to make use of some machine, okay, the analyzer to help you to do this kind of the analysis. So in advance, actually, we will have make use of some liquid chromatography and also the mass spectrometry to analyze a more complicated chemical inside the patient sample. For example, like whether the patient is having like poison or actually they're taking a drug. So we will make use of this kind of the mass spectrometry to help the doctor to make the diagnosis. The third one is actually the hematology and transfusion science. So as named it, which is mainly focused on the hematological disorder. So for example, the leukemia, and also in the laboratory, is also how to deal with the blood transfusions. You need to do the blood group mapping. So in that lab, the MLT is responsible for examining the blood cell count and also the blood cell morphology, doing the blood typing and also the coagulation tests. So this is actually the frame exactly showing the normal blood frame. So in the normal blood frame, you expected to see the red cell, the white cell, and also the platelet. But in some of the times when the patient having the abnormal blood disorder, for example, the thalassemia and also the leukemia. So they will have a very different morphology from the blood frame. So again, I mean, in order to pass these subjects, you should able to identify this kind of the features from the patient. So one of the branch of this hematology is about the coagulations. So there is a disease we call it hemophilia. So that means the patient having a genetic disease that have a problem with the blood clotting. So this test is exactly to identify for diagnosis of this kind of the abnormalities. So this is the blood grouping for typing the patients with AB or O group. So that is you can say this is not a very difficult task, but it allows zero mistake. Otherwise, if the blood mismatch, they will leading to a very naval consequence. And finally, actually, is the medical microbiology and virology, which is actually my expertise. So in this laboratory, actually, the MLT is responsible to identify the microorganism that cause the infectious disease. It composed of the bacteria, virus, fungus, and also the parasite. So after you identify for example, if it is a bacterial pathogen, you will also need to test again the antibiotic to make sure that the bacteria is susceptible to a panel of antibiotic. If not, then we will recommend which treatment should be performed for the patients. In virology lab, actually, other than like and I mean, it's unlike to the bacteria, we make use of the culture. In virology lab, usually we make use of the serology and also the PCR for diagnosis. So this is routine workflow in the clinical microbiology laboratory. So when we receive a specimen from the patients, for example, the stool or sometimes sputum, we need to culture the bacteria from this kind of the specimen and then isolate them from a lot of different kind of the commensal. So we need to do the incubation such that the bacteria can grow of this kind of different kind of culture medium. After that, you will do the microscopic staining to differentiate the bacteria into gram-positive and gram-negative. And we will make use of different kind of tests, including the biochemical test, or lately we will make use of some multi-top mass spectrometry to identify the species of the bacteria. And after that, as I mentioned, they will go for the antibiotic susceptibility testing to see whether the bacteria is drug resistant or not. So this is what I said, make use of the multitoph. Okay, make use of the multitoph to identify the bacteria. So each bacterial species will have a very unique spectra, such that the machine can differentiate the species level identity for the pathogens. So other than this kind of the specialism subjects, you will also asked to learn more advanced core subjects, which include the molecular diagnostic. So you know actually nowadays we have a different kind of the molecular test, not just a PCR, we have a digital PCR, we have a NGS, next generation sequencing, and we will learn about all the not just the knowledge, but also technical skill of this kind of the test. So with all kind of the like the big data, you will also need to learn how to interpret them. So we have a particular subjects, we call it bioinformatics, to teach you how to like extract the clinical information from the massive data, okay, sequencing data or the mass spec data. Of course, you will also learn about the immunologies and also the virology in this program. So the credit distributions of this 2 years curriculum is like this. So as I mentioned, you will go for 2 years, but actually this composed of 6 semesters. So this is how we can differentiate. So in year one, sem one, which I think you have a more relatively is a more relaxing semester. So you still need to study 17 credits. For your information about each subject are usually composed of 3 credits. So you can see actually you need to study at least 5 subjects already in the year one, sem one, and then followed by year two, sem two. So most of the core specialism will start in year one, semester two. And after that, you will go for the clinical placement. So for the year one, you will learn about the microbiology and also the cellular pathology. So in the year one summer, you will go to the hospital to attend to have the placement in these 2 laboratories. And then in year two, you will also learn the remaining 2 specialism, including the clinical chemistry and also the hematology. So after that, and then in year two, you'll also have the semester. Other than this kind of the taught subjects, you will also need to do the captain's project, which is actually a research project. So regarding the professional recognitions, our graduates are eligible to apply for the Part 2 of the MLT board. So currently, actually, our program is being accredited by the MLT board. So we are expect the program will be accredited in the coming April. So all the graduate, meaning that after the graduation, they do not need to take extra examinations, and you are qualified to apply for MLT Part 2 in Hong Kong. And also you can apply for the Institutes of Biomedical Science, IBMS, UK membership after you graduate degrees. And our graduate is also eligible to take American Society for Clinical Pathology. We call it the ASCP examinations. Sorry, this is ASCPI. I stand for international examinations. So when you're a graduate, actually, more of the candidate will trying to apply for the HA, the MLT, the position to start with is actually the associate medical technologist. So usually they will start with the point 13. So point 13 in 2023, I think it's the salary already increased a little bit, around 32,000. Yeah, around 32,000 per month. Uh, not exclude, I mean, excluding the money allowance. So with the monthly allowance, I think it's about 33 Hong Kong dollars per month. So of course, actually, in working in the X-ray hospital, you expect to have a shift duty, meaning that you will need to work in the midnight, and you should have a normal color visions required for the employment. You don't have this kind of the like normal color visions for entering this program, okay, this master program. But after you graduate, when you go to the workplace, the X-ray do require you to have a normal color visions. So the entry requirements. So this is it's not a bachelor degree. This is a master degree. That means all the applicants should have a bachelor degree. Okay. We would prefer that the applicants to have a bachelor degree in biochemistry, biological science, life science, or health related discipline. Okay, because actually we have very demanding program. So we expect you have a very good biology background. In addition to the periods like the degree, I would like to emphasize uh, preference will be given to the applicant to have obtain the credit of the following subjects. Okay, this is a prerequisite. One of the reason is because we have trying to uh, pack a lot of subject into 2 years, but still there is a lot of background subject that cannot be packed into this 2 year program. So we expect actually the candidate already learn about the human physiology, human anatomy, very general human biochemistry, cellular biology, um, mole molecular biologies. So those kinds of subjects. In case you do not have this, I mean, haven't take this subject in your BSc degree, you will be asked to take some of the online course before you enroll to this program. Okay, for example, we will recommend some of the online course for you to study the human anatomy. So those kind of the online course is not organized by PolyU, but actually is organized by some very reputed overseas university. Why we recommend this program? Because you need to go through the assessment after you take the online lectures, and then you got a certificate. We will only need the certificate. Okay, you go through this kind of the training already. Okay, so we will consider it's a prerequisite, or sometimes you can consider as a co-requisite. So we do have a previous applicant that do not have this haven't yet studied this subject, and then he don't manage to have a time to finish this online course before admitting to our program. We allow them to co-requisite. I mean, they can take it while you're already enrolled in this program. So anyway, when before they graduate, they have online study on this subject. Because this is also one of the requirement of the MLT board. Okay, in addition to the specialism, all the students should have this kind of the study. So if you are not a native speaker of the English, and your bachelor degree is not like using English as a medium of instructions, you are asked to take some examination, including the TOEFL and IELTS. So the minimum requirement of TOEFL is 80 or above for the internet-based test. For IELTS, actually, the overall band score should have at least 6.0 or above. So the candidate, all candidate, if it is suitable, we will ask you to attend an interview. Okay, this is 100% requirement that you have to go for in-person interview. So regarding the funding type and tuition fee, this is a self-fund program, and the tuition fee is equivalent to other like professional master in PolyU. So the amount is actually 8,600 per credit, and you need to take 80 credit. So this is actually same price for the local or non-local students. So for the some of the applicants, if you has a very good academic performance, for example, first on from a high ranking university, you can apply for the entry scholarship with you will got around 20,000, okay, in single go.